Hello and welcome to the November 9th Virginia Opioid Abatement Authority Abatement Academy. My name is Jennifer Nelson, Virginia Institute of Government Assistant Director for Membership and Engagement. The Virginia Institute of Government is the leadership development and community engagement arm of the Weldon Cooper Center for Public Service at the University of Virginia. Through our research, leadership development programs, and local government engagement initiatives, we continue to work toward our vision of good governance, equity, and resilience in every Virginia community. VIG offers leadership development through SEI and LEAD, local government equity clinics, certification for treasurers and commissioners of the revenue, and customized training programs. State agencies and local governments can access a range of consultation and support services to build more resilient organizations. We have a team of seasoned public sector leaders and subject matter experts ready and available to facilitate boards of supervisors, city and town councils, leadership team strategic planning retreats, and other related events. Today, VIG is glad to partner with the Opioid Abatement Authority for the Abatement Academy series, with just one more session in 2023 on December 14th, but stay tuned. We've got some things in the works for 2024. A few housekeeping notes. This session will be recorded and posted on Weldon Cooper Center for Public Service YouTube channel soon. If you have any questions, please type them in the chat and I will ask them for you. Thanks again for taking the time to join us today for this Abatement Academy session. Now, I'm happy to turn things over to Tony McDowell, the authority's Executive Director. Tony?
Thank you, Jennifer. I appreciate that. So we really have a treat today. The first grant that was provided by the Opioid Abatement Authority is supporting this incredible effort that you're going to hear about this morning at the Mended Women Lifestyle Recovery Center in Abingdon, Virginia. And we have three of our partners who are involved in developing and managing this project who are going to be presenting today. And it's my pleasure to introduce them. Linda Austin is one of our key speakers this morning. Linda served as a paralegal and a law firm administrator over the course of her 35-year legal career before going back to school in 2012 to earn a human services degree, as well as certification as a human services advocate. She's executive director of ASAC, which stands for the Appalachian Substance Abuse Coalition, the regional umbrella coalition in far Southwest Virginia that has grown more than 1,300% over the last 7 years, with more than 600 members throughout the 13 counties and 3 cities in far Southwestern Virginia. ASAC has 10 community prevention and faith-based coalition programs under its umbrella. Linda also directs Hands and Feet Ministries, which is a jail and prison ministry. She founded this organization in 2008, and the Trail Days Ministry, a seasonal ministry to hikers on the Appalachian Trail, which she founded in 2001. These two ministries combined have more than 300 volunteers. Our next speaker will be Rick Mitchell, who is a family-oriented, lifelong Southwestern Virginia resident and a licensed professional counselor and licensed substance abuse treatment practitioner. With more than 30 years in the human services fields, he has served as a therapist, supervisor, consultant, evaluator, advocate, and trainer educator in many settings. He has spent most of his life working in multi-organizational systems to develop, implement, oversee, and help sustain programs that address unmet or undermet needs on service continuums. He is driven by connections with people and in finding ways to empower them to take purposeful steps in their lives. And finally, last but certainly not least, Bob Garrett has since 1983 been the president and executive director of Fairview Housing Management Corporation. This is a 501c3 non-for-profit housing corporation for homeless and very low-income individuals and families. In the past 5 years alone, Bob has led Fairview Housing in the acquisition and rehabilitation of 125 transitional and low-income apartments and 92 lot single family developments. Fairview Housing has programs in place that fulfill the spectrum of continuum of care, transitioning from homelessness to permanent housing, including home ownership. And so please welcome these three esteemed guests as they tell us about the effort in far Southwest Virginia to build a community coalition to launch this amazing program. Thank you guys very much.
Thank you, Tony, and thanks for the invitation. This is exciting for us to be part of the Academy. And excuse me, of course, we appreciate the funding that we have received that has been such a part of our community celebrating this victory. It's all of us doing it together. So I am a coal miner's daughter, but you can relax. I'm not going to sing to you. I am by no means Loretta Lynn, but a lot of her lineage is part of mine. My father went to work in coal mines when he was very young, many years ago, with a pick and a shovel. He mined for $1.25 a day. And when he was 38 years old in 1958, the roof of the mine that he was in came down on him. He was buried alive in a roof fall. And as you can imagine, he had a lot of broken bones, including his back was broken in 3 places. He spent the next 6 months in a body cast, and he had a wife and 6 small kids at home. So you can imagine how stressful that was. Daddy used to talk about keeping a canary in the cage, in the mine, in the section that they were working in, because methane gas would often surround the workers. And if they didn't do something, they too were in danger of being overcome. It has been said that our region could have been the country's canary in the coal mine, had attention been paid to what started happening here after the release of Oxycontin. Had Oxycontin been available when my father had his accident, his life would have been very different, and my family would have been very different. Perhaps I would not have been conceived, right, in the spring of 61. The methane gas didn't get him, but the opioids could have very likely taken him out. So my father's injuries were not uncommon. The jobs here were very labor intensive. Mining, logging, construction, all of those things saw broken bones and ruptured discs. They saw a lot of deaths that came along with those jobs, but nothing compared to the lives that have been lost to the opioid epidemic. In 1999, the Commonwealth of Virginia lost 326 people to opioid overdose. And that number has risen every year since. We all know the great number that have been lost in the last couple of years, 107,000, 110,000 people last year. I want to think for a minute about the ripple effect of that. How many lives were derailed by those deaths? Children without parents and parents without children, schools and colleges without students, churches without members, and employers without employees. We have all been touched and suffered greatly from the opioid epidemic. When withdrawals started happening here from opioids, people really didn't understand what was happening because they were not addictive. So the calls in the crisis calls coming in and the emergency room visits changed dramatically from alcohol withdrawal, which is what happened here normally, to opioid withdrawal. People were dope sick and they didn't understand what that was because the medication they had been prescribed was supposed to be non-addictive. So Dr. Art Van Zee, who many of us know from Beth Macy's book, Dope Sick, along with therapists Lori Gates Addison, Dr. Hughes Melton, Dr. John Dreisner, a lot of service providers started coming together to talk about what was happening. And they started talking about what to do about the crisis. That's what we do here in Far Southwest. We gather together to figure out what's going on and how best to address it. So Dr. Van Zee was the first to sound the alarm and to tell people that this non-addictive wonder drug is anything but non-addictive. So that group started meeting, and that group eventually became this group, the Appalachian Substance Abuse Coalition for Prevention, Treatment, and Recovery. Pioneers like these went on to become part of the solution. All right, Dr. Sue Cantrell started the first comprehensive harm reduction program in the Commonwealth of Virginia, right here in in Wise County. Tazewell County, the Commonwealth attorney then, Dennis Lee, started the first drug court program. I like to call it recovery court program in the Commonwealth. That was in Tazewell. Of course, both of those things are across the Commonwealth now, but those things started here because that was our response to what we saw happening. Okay, of course, Dr. Melton went on to serve the Commonwealth at large as the Commissioner of Behavioral Health and Developmental Services. ASAC now covers the 13 counties in far Southwest, along with the 3 cities. When we say cities, we have tiny cities, okay, not metropolises. So 13 counties, 3 small cities in far Southwest Virginia. So ASAC gives platform to folks in recovery because we think that's crucial. It gives them the opportunity to give back and to share their hope with others. And it also reduces stigma when people see that people do recover. I personally know people in recovery from every drug known to man, including IV drug users. So there was a time that people didn't think that was possible, but we know now that it is. We invite the faith community to come to the table to hear about the science of addiction and also to hear recovery testimonies. That's important that they understand how to help people while having healthy boundaries with them, because it is also widespread here. There are a lot of churches here in our area, and they are often on the front line when people are in need. So they need to be more aware of the resources that are available. And so we help them learn that when we come together. 97% of the people who evaluated those gatherings said that it helped them feel less judgment toward people in addiction and recovery. So we all walk away better. They are better at ministering to people in addiction and recovery, and we are a stronger community, not looking at one another with eyes of judgment, but understanding the science of addiction and how best to help. So we also talk about and do a lot of trainings about adverse childhood experiences. Those traumatic events often are at the root of addiction, and it's important that people understand that. ASAC is made up of people of every age and every color, every gender, every lived experience you can imagine, every perspective. And we all bring our unique passions and gifts and talents to the table. That's why we are so strong and so able to do the things that we do in our region. With more than 8,000 members, 8,000 followers, we use that website, our Facebook page, our Instagram account. We use that to educate, advocate, and connect people one to another, to connect people to the resources that they need, and to connect those resources one to another to create collaborations and partnerships. Often those things lead to grants coming into our area. So in a 12-month period, ASAC was able to engage more than 558,000 people with the Stop Substance Abuse message. We facilitated 11 Fentanyl Awareness Day events in our schools. We trained and dispensed more than 3,000 Narcan kits to people in our communities. And almost 2,000 of those went to middle and high school students. Unfortunately, we're seeing a lot of students overdose on vaping. Of course, it has fentanyl in it, unintended by the user. So we've had a lot of students go down vaping. ASAC just actually won a national award from the DEA for our prevention efforts. So we're pretty proud of that. And we're pretty excited. It came with $3,000. So we're going to put that money to good use. So through ASAC, we bring people to the resources they need, right? But that's really difficult, extremely difficult when those resources do not exist. And that's what we were experiencing when we had women who needed treatment, because it just wasn't available here in far Southwest. So we have 5 jails here in our region, 5. And at any given time, those 5 jails have about 500 women in them. More than 70% of those women have a history of substance use disorder. And the doors would pop open and there would be nowhere for them to go, nowhere for them to get treatment in our area. So within 150 miles of Abingdon, where I'm sitting right now in Washington County, Virginia, within 150 miles of us in the Commonwealth of Virginia, there was not a treatment program, a residential treatment facility for women. And so we had many conversations like we do here in far Southwest, but we finally decided to do something about it. So Ann Ledgerwood is a friend and a pediatric physical therapist. So day in and day out, Ann sees and treats children, infants and children who have been substance exposed and affected. She also has Samaritan House Ministries, which does a lot of reentry work. So she and I both get calls often from correctional facilities trying to place women with a history of SUD. And so we talk often. And so we decided to have a Zoom meeting in December 2021, on the 29th of December, between Christmas and New Year's. We decided to have a Zoom meeting and see who would come. All right. So we did, and it turns out there were 4 of us, only 4. That sounds like a really small number, but it turns out that 4 was enough to get us started. And so 2 weeks later, we met again, and we had identified a building in that 2-week period, right? And it's perfect for Mended women. It's actually open and functioning in that facility right now. So ASAC has been part of this effort from the beginning because we needed to fill that gaping hole in our recovery ecosystem here, because without it, people continued in that cycle of addiction, and it went from generation to generation. So that group that started on December 29th, 2021 became the Women's Housing Coalition. And we have helped bring $1.5 million to date into our region. Of course, as Tony said, we received the first grant from Virginia Opioid Abatement Authority. And then additional second grant to help us buy the property. So Mended Women Lifestyle Recovery is a program of Fairview Housing, a local nonprofit with more than 20 years experience in recovery housing. At that point, they had Bristol Lifestyle Recovery open for men. And Rick is going to talk more about the lifestyle recovery programs in just a minute. But we knew from their history and their record that they were able to do what we needed done. Okay. So when we had this meeting, Bob Garrett, I have known for years. He is the CEO of Fairview. And Fairview has been part of ASAC for many years. So we've all been working together. So I reached out to Bob, asked him to come to our first meeting. He's part of my social capital, right? the wealth that we all have in the relationships that we are blessed to have. So I would ask all of you, who is part of your social capital? Who do you know? And who do you need to know to make whatever you're aiming toward with this opioid grant money? Who do you need to know to make it come to fruition? So Bob came to that meeting and he told the Attorney General when he was with us on April the 13th to cut the ribbon that he didn't really think anything would come of the meeting in the group when he was asked to attend. But ever since, he has been surrounded by determined women. And that's true. We were determined and we are still determined. We are determined that our mothers and our sisters and our aunts and our daughters find wellness and have the opportunity for that to happen. We are determined that they live, and they live the abundant life that they were created to have, the life that they only dreamed of having. And so we know that can happen when they find recovery and when they find wellness and when they find the support group to support them and wrap around them in those efforts. In March 2022, right, we had a small group of people. We had our eyes on a building in Abingdon, but we had no funding. So ASAC sent 10 people to a conference in Nashville, a women's housing residential treatment program. And there we met 2 women, and one of them and her husband have a foundation in Falls Church, Virginia. So we went from far Southwest Virginia to Nashville, Tennessee to encounter 2 women who was looking for a project in Appalachia, mind you, to fund. And so they committed to help us. And it was that day in March that I realized this was really going to happen. So we had nothing but a promise of money, but it was enough to get us excited, right? June the 4th, 2022, we had passionate people. We had a promise of some money, but we didn't have any money in hand. The next day, on Sunday, the 5th of June, we got our first donation. And on April 10th, 2023, when the OAA grant came to Washington County for us of $115,970, that was enough to give us the money that we needed, $719,000, to open Mended Women Lifestyle Recovery. So the ribbon was cut on April the 14th. So we continued from March 2022, right, to April 23. We didn't sit on our laurels. We worked. We had t-shirts printed that said, "Ask me about Mended Women," and we wore them everywhere. We went to the farmers market. We asked churches to allow us to speak to their congregations, civic organizations. Anybody who would listen to us, we talked to, okay? We had a music event where we raised more than $20,000 because people want to be part of good things that are happening, right? We applied for 7 grants and we received 6 of them. All right. So we have brought great hope and excitement to this community, especially to the recovery community here. We created a Facebook page for Mended Women. And on that page, April 21st, 2023, the building was ready. Everything was painted. We were ready to decorate. At midnight on Friday, the 21st of April, we put a Facebook post up that said, "We have rooms that need to be decorated. If you'd like to adopt one, let us know." And by Sunday evening, all 38 bedrooms and bathrooms have been adopted. Actually, more than 100 people wanted to adopt a room. That's the excitement this facility has brought to our community. Okay. So we have had many open houses. We always invite the press because they love to tell a good story. They want positive news. We had more than 30 people every hour that we had open houses come to this facility to have conversations, to look around, to pray through the halls. So it's been priceless, the gift that we have given through our partners to this community. So working together, we've been able to bring people to the table. Through our social capital, we've brought experts, volunteers, funds, community support, and an amazing staff that you're going to see a picture of here in a minute. So we went back to the Washington County Board of Supervisors to thank them and to update them and let them know what was happening. And they were so grateful to be part of this. I was just talking to some of our board members, our Board of Supervisors over the weekend, and they are just elated. Every time I see them, they want an update because that place is theirs. It's ours. It belongs to all of us, to the community. So Board of Supervisors has been incredible to support us. They gave us $200,000 of their own opioid money in addition to applying for OAA funding with us. So they've just been such a support. So in summary, I will tell you, and I will click this little, there you go. I don't really like PowerPoints. I like people better. So, but relationships are key, right? They're gold. So who do you know? Who is in your circle of influence? All of us know people, but we also know people who know people. Your friends, people, your colleagues, they're willing to speak to their circle on your behalf. So tap into your friends' social capital as well. Attend trainings and conferences every chance you get. And don't sit with your people. Don't share a table with the people you rode there with. You can talk to them on the way home. Connect with the people who are attending the conference because they have something in common with you. Great networking opportunities and connections. I always come home with cards and I immediately send emails and reach out to people, right? Connect with people you don't know. Your agency, your ministry, and you personally need to be part of your Chamber of Commerce. The county is strong because of that collaboration in the chamber, but it's also a great networking opportunity. Go to ribbon cuttings when you can. They're normally at lunch or at the end of the day. The potential connections are priceless. Get involved in your local coalitions. And if you have a regional coalition like ASAC, get involved with that too. You're welcome to get involved with ASAC. We meet every other month somewhere here in far Southwest, and it would be a great reason for you to come down to far Southwest. I personally think it's the most beautiful part of the Commonwealth, but I'm a little biased. But get involved with civic organizations, book clubs, anywhere that you can connect with people. Go to recovery court graduations. Support your recovery court. They're doing amazing work. You can learn so much by going to recovery meetings, open meetings. You can find those online. Don't open your mouth. Listen to the struggles and also the triumphs. Learn to really know what they need and how best you can serve them. Get involved with your leadership programs in your county. And also the Commonwealth of Virginia has Lead Virginia, which is another great place to connect with people, leaders who have great ideas and great resources. So attend town council meetings and board of supervisor meetings. Don't go when you just have something to fuss about. Go to support them and just thank them for their leadership. If you love where you live, somebody is in a leadership position, making that a great place to live. So go and thank the people who are responsible. Okay. Create relationships with those people, your representatives. become part of their social capital and them yours, because we're all better and stronger together. So I would encourage you to consider tapping into your social capital, because honestly, a lot of people have depleted that. If they ever had it, they've depleted it, and they need some of yours. So make good things happen through your social capital. Consider and tap in, okay, all along the way in your circles. I recently, in the last few days, on behalf of Mended Women, ASAC, and my ministry, have reached out to 9 individuals, asking them to come on boards, board of directors, and also advisory councils. 9 people, doctors, lawyers, therapists, concerned parents. 8 out of the 9 said yes. And they said, thank you for thinking of me. Thank you for allowing me to be a part of something good that's happening. Don't feel like you're burdening them. You have something valuable. You have something valuable. Understand that. And anybody that you ask to participate in what you're doing, you're allowing them to be part of the solution as well. So realize the value that you have that you're sharing with people. Okay. And I will tell you one more thing. By the way, my father, that 1958 roof fall didn't stop him. If you look up mountain grit in the dictionary, you're going to see a picture of my dad. Okay. He retired from mining in 1980. 1980. Yes. And I obviously was conceived. I was the 7th of 7 children. So I completed a little family of 9. I tell my siblings, our parents reached perfection with me, right? And stopped. That's why I'm the youngest. They have a different story to tell. Apparently I was a hellion. So now I want to show you what I've been telling you. Tony, here's my broom. It's not easy for y'all to see on this computer screen, right? Can you see this? I don't know if this is going to work. So I have a broom in my hand. Aha, see that broom? If I ask any of you to sweep the room that you're in right now with this broom, you could, right? And you would, because you're servant leaders. But if I ask you to do it with this, can you see that straw? It's one piece of this broom, one piece. This is us individually, right? This is us as a coalition or as an agency coming together for one purpose, right? But take that a step further, and this piece of this straw is our agencies or ministries or churches. This is our community. This is more effective and better able to serve its intended purpose when all of us come together bound for one purpose. And that's what happened with Mended Women. And that's why the women in Far Southwest are being taken care of right here at home. So thank you. With that, I will turn this over. There is another slide here to just show you. Here's my contact information. Any of you who want to get in touch with me, please do. I'll be happy to have a conversation. Here are some pictures from the facility. This, of course, is the outside up here, our patio. It sits on 6 beautiful acres of property. Here is our hallway. One of our volunteers, the first time she walked in, she's like, man, this looks like a luxury hotel. So thank you. That was the look we were going for. So here's our ribbon cutting, of course, with General Miaris here. This is Sean from Wellspring Foundation. Of course, Cody from Morgan Griffith's office. Here's our Commonwealth attorney, lots of board of supervisors. Israel O'Quinn's back here. This is Amanda Pillion. She is Senator Todd Pillion's wife, and she is also the mayor here in Abingdon. Here are a couple of our bedrooms. Here is our amazing staff. Here are just a couple of the things that we did. No roof, no recovery. That is just a big music event that we did at the higher ed. It became quite the social event. People were dancing and hanging out. They absolutely had a blast. We had so many local artists who wanted to be part of. We had to limit it. It went for like 6 hours, which was too long, but everybody wanted to be a part, right? Our local college, Emory and Henry, their choral concert this spring was about addiction and recovery. They made it a benefit for Mended women. So they helped financially, but they also raised great awareness for us. They have been very supportive. The faith community has been incredibly supportive, adopted several rooms, had a spaghetti dinner that brought in like $2,500. This church, Abatement Baptist, last year in November, Ciandra Lewis, this cute little blonde who is in recovery, she is incredible. She is the peer recovery coordinator for the Commonwealth of Virginia's Department of Corrections. She spoke that day in the service, and every Sunday in November, they took up a love offering for Mended women. And I think, Bob, it was between $45,000 and $5,000 that they donated. And this is just, we have a facility full of positive messages because we want people to know it's up to them. They have the choice to live well and have a good life. They have the tools to succeed, and we want them to be reminded of that regularly. So I'm going to quit talking. Thank you all.
Linda, that was fantastic. Thank you so much for sharing. I'm sitting here smiling, thinking of all the great works that you've done in West Virginia, continue to do. And from my understanding in the pre-meeting chat, all the things that are still to come. So thank you, Linda, for sharing that.
Thank you.
Bob and Rick, are you going to share any words of wisdom with us too?
Certainly, happy to. And thank you all of you, for caring about these very important issues. My dad was also a coal miner, was hurt twice, once in his 20s, once in his early 40s, that ended his coal mining career. Every man in my family was a coal miner, all of them, as far back, generation wise as we can ascertain. My mom is the youngest of 13 kids. My grandmother had babies from 15 to 40. And so my mom was the youngest of 13, first to graduate from high school. She started college when I was in kindergarten, and got feedback from her brothers who, were well-meaning in their statements, but nonetheless would make statements like, my mom was just running around wasting money, things like that, while she was going to college. My mom always had a belief in education. They instilled that in me. So as a 20-year-old college senior, I started work as an unpaid intern in a maximum security state prison. The state had created an effort to help a generation of young people have a different opportunity other than coal mining industry. And I jumped on that and started working at a prisons treatment center at 20, and started doing prevention work full time at 21. And so over the course of a 30+ year career at this point in time, I'm able to, have a family who in the immediate circles are not in any kind of, severe, addictive type tendencies. And that's because opportunities were granted and opportunities were ceased. The only difference between, me, my family, and the next family that we may be helping, that you aren't, maybe seeing on a screen today, is that, when I went into a hospital when I was in my 20s for a legitimate medical concern, and was given, in the critical care unit, was given a Demerol drip. My interaction with my family was, I don't like this. And the only difference between me and somebody else is that I didn't have some sort of genetic issue um, or a social issue at that point in time that caused me to develop this addiction to these things. And fortunately, the pain subsided very, very quickly, and it wasn't a long-term issue. As we know, these issues are they're rampant, and no family is immune. And what we do know is that we were targeted. I mean, Linda's family, my family, were targets and chemistry experiments, as is commonly said. And so we're able to sit here, today in in a Zoom meeting and communicate with you about how to help people. And Appalachian culture is all about connection, and recovery is all about connection. I've been able to work for public, private entities, vice chair of ASAC, and serve in a lot of different functions, and continue to do so. And one of those things that has been able to cultivate is a lot of connections, and through those connections, continuums of care. Like everybody that's involved and everybody who cares, every single one of you on this call, I'm certain, is involved in some system of care. We don't do it alone. We're not, one little straw in a broom. We try to do these things together. So on your screen, you see just a few. I mean, this is just a snapshot of some of the systems of care in communities between medical providers, hospital systems, legal, mental health, behavioral health systems, workforce, homelessness, HUD programs, social service programming, social supports, medical support, spiritual churches. I mean, everybody has systems of care, and people have different levels of need. And ASAM, which is, I've got SUD and ASAM criteria, substance use disorder, American Society of Addiction Medicine criteria. That's an area that I've focused a lot of work on over the years, and so have many others on this call. And so all of these things working together, all of us are a little spot somewhere on a continuum, but we have a large influence over the other components of the system, the ladder rings that are just under or just above. And then we have influence on those and how well those components come together to benefit and help those that are in the most need. And so wanted to talk just a minute about, how do we pull this off? Well, one of the things is community assessment. NASAC is huge on community assessment, and you ask anybody who works in some sort of human service arena or a legal system or any of those entities that I just named or more, and they will tell you where the gaps are. And so community assessment told us that there was a need for housing, and that there was a need for housing for women. There was a need for treatment for women. And so over the course of the past 3+ years, between Bristol Lifestyle Recovery and now Mended Women Lifestyle Recovery in Abingdon, we've helped treat about 500 people, over 500 people now. And people have come into our centers, men into Bristol Lifestyle Recovery, women into Women's Lifestyle Recovery in Abingdon. We've served about 150,000 meals. We've had about over 50,000 bed nights from people who have slept in a comfortable bed in a temperature controlled room that they negotiate with some roommates. They learn social skills. They attend treatment. They attend groups. They get individualized planning and care coordination and medical care and counseling referrals and all sorts of things, dental, medical, you name it, and try to integrate those things. So that's what our community assessment told us that we needed. So there's no one single answer. And so what I'm encouraging you to do is to talk to the people that across agency lines, and reach out the olive branch. Start that process yourself. most people who are in these types of fields like people and want to tell their story, and they want to listen to yours. And so that's what develops all of those connections. One thing that our community assessment also showed us is that social determinants of health, which is the next slide, is a huge component of people getting well. What we do know is that one system doesn't fix an issue or even give the tools for somebody to overcome, significant concerns in their own lives. And so education, medical, housing, financial health, community coalitions, the community networking, people spending time with positive people, all of these things and more are called social determinants of health. And so those are things that really need influence beyond just medical or healthcare world. And so everybody here has some influence on people with social determinants of health. I just gave you some, kind of outcomes, impact data from some of the work that we've been doing in Bristol and Abingdon over the past 3.5 years. Those are just a few little components, and we can run through those numbers and all that sort of stuff really, really quick. And it may, kind of just, glance off a little bit. But what it really means is that we're meeting people where they are, when they need to be at that point. So, in our world, it's really difficult. I say all the time, it's really difficult for somebody to think about self-actualization, when they're hungry or cold and afraid of whoever's in there in that space with them, if they even have one. And so in our world, it's meeting those basal level needs and then working up from there and linking and referring and helping people develop positive, healthy connections for everything beyond that. So the next slide's just, it's ASAC and Fairview. And so I've had a private practice for a long, long time. Done a lot of different work with different agencies, became involved in ASAC about 5 or 6 years ago. And so it was through connection, Fairview Housing, which I'd never heard of, mutual friends. You talk about social capital. Mutual friend who has some influence called up and said, these folks are doing some amazing work, and they need somebody in behavioral health. They need somebody who's done programming and led programs and on the treatment side and those sorts of things. We've got, housing folks who are wonderful at it and wonderful community servants. And they're inching in through partnership with, this ASAC coalition to try to provide some, recovery work. And so that was music to my ears. And through 2 or 3 different mutual social connections, became involved and brought a quasi healthcare component to a housing program, all through the use of all of these things: prevention, treatment, recovery, coalition, housing, social capital, and all of this came together so that we are able to serve today. Today we have about 100 people in those 2 facilities. And if you walk up and down the halls, just asking people about their experiences, I never walk up and down a hall anywhere without hearing, this place saved my life, or I wouldn't be alive if it wasn't for here. I'm getting healthy. I'm making connections because of here. And so I'm grateful to you for serving. I'm grateful to my peers, and keep the connections coming. And at that, I'm going to turn it over to Bob to chat about Fairview for a second. But thank you all. Really, really appreciate you.
Thank you, Rick. Yeah, when Linda called me about this project, we had only been open at Bristol Lifestyle Recovery for about 1.5 years. And so we really weren't looking for a new project quite that soon. But, when Linda called, one of the thing that she left out of her comment about me thinking that, probably wasn't going to go anywhere was the fact that the reason I did is because she called me. And so we're part of that social capital. As she said, myself and Fairview Housing has been a part of ASAC for a long time. And so when she called, I decided to get involved. And I was literally shocked at how quickly all these things came together. And I've been a developer and real estate manager of low-income housing for almost 40 years. I've been in a lot of different communities, starting projects, always run into some kind of a wall that is hard to get around or over. And I have to tell you that in Abingdon, from our immediate neighbors at Mended Women Lifestyle Recovery, to the city, to the county, to the state opioid abatement authority, I've never seen everything work so smoothly and so quickly. And I'm extremely proud to be a part of this whole process. Fairview Housing has been around for about 53 years. And when we first started a transitional housing facility in Johnson City called Manor House, we were just trying to help homeless people have a roof over their head. And so over the years, it didn't take us too long to realize that if we were going to really help them, we had to help them with all of their problems and issues. And so probably 80 to 90% of the time, that included some form of addiction. And 25 years ago, there really wasn't much research or there wasn't a lot of data on how to do addiction recovery. So we just started trying to do what we could as we went along. And over the years, we've learned a lot. And we have, as the slide shows you, we have 40, probably more than 40 now, community partners, which we call social capital now because of Linda. But we try to help them with all of their needs, not just their addiction issues, but anything that they're having a problem with. If they're having a major problem or a crisis in addition to addiction, it's going to be real hard for them to have a lot of success with recovery. So we help them with basically anything such as medical, mental health, legal, family relationships, workforce development, any type of benefits. A lot of our residents are veterans, and it is extremely hard for a lot of them, especially with something like PTSD, to even go through the process to get their VA benefits. So that's one of the things we do is help them through that process. And it makes an absolute huge difference in their lives. So, I guess our overall view is to try to help them as much as possible while they're with us. Some of our programs are more short-term. We even have some emergency housing beds in Johnson City, and all the way up to helping them end up buying a home while they're with us. They may save enough money to have a down payment on a home, and while they're with us, they're working, and so when they leave us, they're really ready to go out into the community again. And one of the things we always say is we try to help people become self-navigators, through life with any situation that they have. So, as the slide shows, we have our service area is 13 counties in Southwest Virginia and 11 counties in Northeast Tennessee, which just happens to be for a long period of time, it was the absolute worst place, not only in the country, but in the world for addiction and overdose deaths. And I think we're now maybe down to the second or third worst, but that just happens to be the areas that we cover. And so a total of 300 beds, 150 in Tennessee and 150 in Virginia. And so it's been a real eye-opener through the years, but it is a very difficult thing, try to do to help people get their life back. But it's very rewarding when we see that happen, and we see it happen a lot. We have a very high rate of helping people get their life back, very high compared to the rest of the country. So we really appreciate everybody that's been involved in this project, and especially the Virginia Opioid Abatement Authority. And it's been a pleasure, and we thank everybody, and we hope to continue that success. And if anybody would like to call us, feel free to. And we are definitely community minded, and we don't mind giving advice or steering in a certain direction. So feel free to reach out if needed. Thank you very much.
Thank you so much, Bob. Thank you, Bob, Rick, Linda. These are great resources, and you've built so much in Southwest Virginia. Thank you. We're open to questions if you want to put them in the chat. If not, I'll let Tony talk about all the exciting things coming up with the Opioid Abatement Authority.
Thanks, Jennifer, and thank you to all of our presenters today. This is not the first time that I've heard these fine folks talk about what they're doing, but each time I hear it, it's just encouraging, and it's just such a great work that you're doing, and we love to see examples of this pop up all around the Commonwealth. So just as a announcement, we mentioned at the beginning, there's still one session of the Opioid Abatement Academy scheduled. That'll be on December 14th. We will be talking about how to identify gaps and measuring impacts in communities. That's an overview of the framework for addiction analysis and community transformation, which is the Commonwealth's data storage warehouse for addiction-related programs. And Leslie Egan from the Department of Criminal Justice Services, who's the program manager, will be making that presentation. Next year, in 2024, we will continue the Abatement Academy, and we're currently working on putting together the program, and we'll share that with you as soon as we can. It looks like there might be a couple of no questions, just comments in the chat. And so I think we're probably close to wrapping up. Thank you again to our speakers. Great presentation. Always learn something new from these fine folks. And I'll tell the rest of the folks that are watching, if you find yourself down in Southwest Virginia, go by Abingdon and see the Mended Women's Treatment Center. It's amazing. So thank you again. And Jennifer, I'll turn it back over to you to wrap up.
All right, I've got nothing more to say. You guys want to thank you again, and we'll see you in December. Take care, everyone. Happy Thanksgiving.